Hello, future registered nurses. My name is Priscilla Mendez, and today I will be presenting my signature assignment on both hypertension and hypotension. This will be an overview of an in-depth analysis of the anatomy, physiology, etiology, disruption, and treatment of blood pressure. So, what is blood pressure? Oftentimes, upon intake, patients will ask, what is blood pressure? What does it mean? So blood pressure is the force of your blood pushing up against the walls of your arteries as your heart pumps. So the normal range, textbook wise, is 120 over 80 millimeter mercury. The top number is called the systolic. Systolic means your heart is contracting, as we know. And then the bottom number is called the diastolic. Diastolic means that your heart is at rest. You have to think of it like a garden hose where water's flowing through it and the right amount of pressure keeps everything running smoothly, but if the pressure's too high or too low, problems can occur. So elevated blood pressure, also known as hypertension, is a condition where the force of blood against the artery of your walls is consistently too high. And this is typical in blood pressure that's over 140 over 90 or higher. It can often result in factors like obesity, genetics, prolonged stress, leading to cardiovascular risks. And then we have hypotension, hypo meaning low blood pressure, and this can occur when your blood pressure falls below the normal range. This can cause things like vertigo, which is dizziness, fainting spells, and this can be caused by things like dehydration, not eating, blood loss, and infection. So organ systems primarily affected by hypertension is the cardiovascular system. And this is because your heart is having to pump a lot of force to the arteries, the heart, the kidneys. While hypotension, on the other end, it's affecting a lot of your other vital organs, your brain, your kidneys, everything. And with hypotension, if you don't have adequate amount of blood supply carries oxygen, that's when other problems occur, like the dizziness or the fainting spells. Biochemical pathways, RAS, we just learned about this in physio. RAS is renin, angiotensin, aldosterone system. Try to say that 5 times fast. It's a key regulatory system that increases blood pressure by vasoconstriction and sodium retention. Normal regulation of blood pressure involves complex biochemical pathways, which modulates blood volume and vascular tone. And we're all familiar with negative feedback loops. This is a picture I pulled from our textbook. This is a negative feedback loop for blood pressure. The stimulus in this photo would either be sudden increase or decrease in blood pressure. And the receptors are the baroreceptors in the carotid and aortic arch that detect the fluctuation of the blood pressure. The baroreceptors will send a signal via glossopharyngeal, which is cranial nerve number 9, and the vagus nerve, which is cranial nerve number 10, to the medulla oblongata. For blood pressure, you have to remember that it's part of the fight or flight in the sympathetic nervous system. So neurotransmitters such as norepinephrine is vital for communication for rapid adjustments of blood pressure in response to environmental changes. And you will notice this when you check a patient's blood pressure, that it's very situational. If they're nervous, if they have so-called white coat syndrome, which is they're nervous to be either at the doctor's or hospital, their blood pressure will be elevated. Genetics can be both a pro and a con, and unfortunately, in this instance, it can play an influence in your susceptibility to either hypertension. Variations in genes related to RAS and vascular smooth muscle functions contribute to your risk and likelihood of hypertension. Blood pressure homeostasis is maintained through regulatory mechanisms involving the sympathetic nervous system. Again, that's your fight or flight. The endocrine system, that involves the kidneys, and then, of course, the cardiovascular system, which is your heart. And then these systems work together to ensure adequate blood flow to all organs while preventing fluctuations. Hypertension is usually a combination of genetics, hormonal imbalances, lifestyle factors, while hypotension usually stems from dehydration, not eating, blood loss, and heart problems. some diagnostic tests and AI models. First and foremost, this begins with an appointment to your primary care physician. Upon intake, the nurse will check your vitals, which this includes your blood pressure, and then he or she will get an extensive past medical history if you have one. And then if you need one, if you are symptomatic or it's necessary, the physician can order an EKG. An echocardiogram, that's usually done at a cardiologist. Primary care physicians usually don't do echoes. And then the doctor can also order a blood test. Some AI models that I did find were, a lot of people are now implementing Apple Watches, Fitbits, Samsung Galaxy Watches, but I would not rely on those because those are faulty. The number one way of checking your blood pressure is emptying out your bladder. And then you want to sit down for about 10 minutes. Make sure you're not laughing, no talking, just rest. Put your left arm at heart level. Wrap the cuff around your left arm about 1 inch above the antecubital space. And just relax and check your blood pressure. If it's elevated, of course, discuss that with your primary care physician. And if you notice a trend of elevated blood pressure, this is when you would want to start having the conversation with your primary care physician of maybe starting some antihypertensive medications. Some antihypertensive medications are medications such as lisinopril, losartan, amlodipine, and they can even start you on a diuretic. Diuretics help you urinate. A diuretic such as Lasix, hydrochlorothiazide, and then ACE inhibitors, beta blockers. And then for hypotension, they're going to want to help you replace fluids, get that blood volume up, and then maybe start you on an antidiuretic medication to help you not urinate as frequently. Upon follow-up with your primary care physician, oftentimes they're going to recommend lifestyle modifications to see what you could do on your own before having to start you on a low-dose high blood pressure medication. And this includes a healthy and balanced diet. Limiting your sodium intake is key. Starting a regular exercise, so for about 30 minutes a day. And then, although this is easier said than done, try to limit your stress levels because this is crucial in managing your blood pressure. Ultimately, the main goal is to not have to start you on any blood pressure medications, because with medications then comes side effects, possible side effects, and copays. Global incidence and prevalence. About 1.28 billion people worldwide suffer from hypertension. Low to middle income countries face a typical higher rate, and this is because they have a lack of healthcare access. And then some other risk factors include your age, genetics, obesity, sedentary lifestyle, high sodium intake, and then excessive alcohol consumption. Mortality rates in hypertension is fairly significant. It's about 67% of people either go untreated or unmanaged. It's very important that patients follow up with either their primary care physician or even a cardiologist to help manage and treat their hypertension. With doing so, this will help reduce the likelihood of either a heart attack, a stroke, or even death. And this concludes my signature assignment on both hyper and hypotension. If you made it this far, I hope you learned something new, and thank you for watching.